By now, I am sure that most PCare member agencies and supporters are well and truly aware that we have embarked on an ambitious program of child and family policy and service reforms arising out of recommendations of Queensland's Child Protection Commission of Inquiry and the state government's response to those recommendations. While the inquiry was assigned the responsibility of charting a roadmap for child protection over the next 10 years, a fast pace is now being set on addressing a number of priority areas, and if you haven't as yet been impacted by the process of reform, I'm sure that you soon will be. It's for this reason that PCare has entitled this short video, "The Road to Reform, Hitting the Ground Running." Our purpose in producing this video is twofold. Firstly, it is to describe to you the various forums and groups that are in place or about to be put in place to plan and coordinate the program of child and family policy and service reforms. In other words, the governance arrangements for managing the reform process. Secondly, and very importantly, it's to describe for you the communication strategies that PCare will be using in parallel with the work of these various forums and groups. These are the communication strategies that we intend to use to keep you informed about the work of these groups and to provide you with information that may assist you and your organisation to contribute to the work of these groups, as well as your own organisation's planning for the future. It's also about obtaining your views and ensuring that they're considered in the planning and implementation of the reforms so that we can draw on your experience as providers of child protection services and family support services, and as well as, very importantly, the experiences of children, young people and families that are the recipients of your organisation's services. So the purpose of the video is twofold. It's to keep you informed, but it's also to describe to you the ways you can keep us informed, both informing you and informing us. Some of the key challenges about reform processes are that when people come to the table to design them, they often don't know what they don't know. In drawing on our own experiences, sometimes we can overlook the experiences of others. So some of the major challenges we've got are to sometimes look beyond our own experiences and what we know to the experiences of others. In particular, it's about looking to evidence-based research and the experiences of other states and international experiences as well to inform what we might be doing here. This is the only way we think that we can ensure that we're not bound by what we know and that we can more fully explore what might be possible. Very importantly, and in keeping with co-design principles, it's about ensuring that we listen to the voices of children and young people themselves and their parents, and ensuring that they are also active participants in the co-design process and the process of reform. Before proceeding to describe the governance arrangements, I thought it might be useful to recap on the road to reform so far, some of the major milestones that have been reached. Firstly, on the 1st of July 2012, the Queensland Child Protection Commission of Inquiry, led by Commissioner Tim Carmody, was established. PCare's contributions to the inquiry included, within the first few weeks of the inquiry being established, providing a catalogue of key reports, submissions and other documents that we produced over or commissioned over the past decade. They numbered around 40 major documents that we supplied to the Commission of Inquiry. In October 2012, PCare lodged our first preliminary submission to the inquiry, which very comprehensively charted what we thought was the roadmap to the future. During the course of the inquiry, we produced and provided copies to the inquiry of 2 discussion papers, one addressing permanency planning and the question of adoption, and a second one addressing the issue of secure care, needed or not. And then in March 2013, we provided a very comprehensive response to a discussion paper released by the Commission of Inquiry in February of that year. During the course of the inquiry, I also had the privilege of being a member of the Commissioner's Advisory Group. At all stages during the inquiry and the production of those reports, we were informed very much by the opinions and the views of our member agencies. We did this through conducting roundtable discussions and the production of a set of position papers that we produced prior to the election of the incoming government. We also conducted during the course of the inquiry 4 child protection Meet the Preventers Expos in various locations throughout the state, and staff of the inquiry attended each of those expos. And around specific matters, we held other consultation exercises such as teleconferences and discussion groups. Around 1 year later, on the 1st of July 2013, the Commissioner presented his final report, Taking Responsibility, a roadmap for Queensland child protection, to the Queensland Government. PCARE's response to this was to very quickly run 7 roundtable meetings across the state of our members, and we did that in partnership with the Queensland Aboriginal and Torres Strait Islander Child Protection Peak. We produced a report about the outcomes or the views of our member agencies as well as QUADSIP member agencies to the government. Very quickly after that, we also surveyed our member agencies to find out the range of views and opinions they held about what PCARE said. And that included those areas where there was agreement, but also those areas where there was disagreements or a range of views. On the 16th of December 2013, the Queensland Government released its response to the Child Protection Commission of Inquiry final report. Their response indicated they fully accepted 115 of the recommendations and 6 were accepted in principle. To recap on some of the major themes presented in the inquiry's report, there were 3 tracks that were noted as forming the roadmap. The first track was about reducing the number of children and young people engaged in the child protection system. The second track was around revitalising child protection frontline services and family support in particular, and breaking the intergenerational cycle of abuse and neglect. And the third major track was refocusing the oversight placed on learning, improving and taking responsibility. To break that down further, in regard to that first track, there were recommendations made about diverting children and young people from the statutory system, and in particular increasing access to family and individual support services as a major method of reducing the number of children and young people in the child protection system. In relation to the second track, there were recommendations made about improving child protection practice, about working collaboratively across sectors and professional disciplines, about the development of a skilled workforce and carers as well, increasing the access that children and young people in care have to support, about building the range of options of out-of-home care settings and increasing the stability of children and young people's care experiences. In relation to the third track, there were recommendations made about better defining the strategic directions, the departmental responsibilities held not only by the Department of Communities, Child Safety and Disability Services, but also the responsibilities of other departments in ensuring that there is a whole of government approach to child protection, and recommendations made about the governance of the reform process. Specific recommendations were made about the involvement of external stakeholders at every level of that governance, redefining the ways in which systemic and individual advocacy is undertaken, improving child protection court and tribunal proceedings, about reducing the duplication of effort that sometimes goes into managing certain processes, for example around complaints processes and management of child death reviews, and also recommendations about ways in which red tape could be reduced through streamlining processes such as screening practices, outsourcing some fostering kinship care responsibilities, and also recommendations are made about costing of service delivery responses. In looking at each of those, the tracks to reform, the government has identified 7 strategic directions that it intends to pursue in supporting implementation of the reforms. Those 7 strategic directions include, firstly, sharing responsibility for the safety and wellbeing of Queensland children. Secondly, supporting Queensland families earlier. Third, working better with Queensland families who are in contact with the child protection system. Fourth, improving out-of-home care and post-care for Queensland children and young people. The next is meeting requirements and needs of Queensland's Aboriginal and Torres Strait Islander children, families and communities. The next was delivering quality services to Queensland families and children through a capable, motivated workforce and client-focused organisations. And lastly, building an accountable, transparent and cost-effective Queensland system. There'll be plenty of arrangements made to inform you further about the content of those recommendations and how they break down further into various projects. This video, though, will be concentrating on the governance arrangements for those reforms. In keeping with recommendations made by the inquiry, There is a high-level portfolio responsibility now assigned to what's called a Child Protection Reform Leaders Group. Some of the broad portfolio responsibilities held by the Child Protection Reform Leaders Group includes exercising oversight of the reforms and the process of reform, reporting on performance and the benefits being achieved from high performance, and cross-agency and regional coordination. Non-government representation on the Child Protection Reform Leaders Group is provided by Natalie Lewis, the CEO of the Queensland Aboriginal and Torres Strait Islander Child Protection Peak, and Mark Henley, the CEO of QCOS. In addition, and in keeping with recommendations also made by the inquiry, the Family and Child Commission will soon be established to replace the Commission for Children, Young People and Child Guardian. That Family and Child Commission will also have broad portfolio responsibilities about exercising ongoing responsibility for the external oversight of the system and its operations, about monitoring of performance and cross-sectoral leadership. Again, in keeping with recommendations made by the inquiry, an Aboriginal and Torres Strait Islander Child Protection Service Reform Project Committee has been formed. That project, according to the recommendations made by the inquiry, has a 12-month lifespan but may be extended. In keeping with recommendation 11.2, the Reform Leaders Group has established the committee specifically to formulate and address the responses to recommendations of the inquiry addressing the overrepresentation of Aboriginal and Torres Strait Islander children in the child protection system. This committee is jointly chaired by the Deputies Directors General of the Department of the Premier and Cabinet and Department of Aboriginal and Torres Strait Islander and Multicultural Affairs. The committee comprises representatives of several government departments. Also represented on that committee are peak bodies including QATSIP, Peak Care and QCOS. Sitting underneath that broad portfolio area of responsibilities are three interrelated areas. Firstly, program development, project development and the application of that to place. Sitting at the intersection of those is a very key forum called the Stakeholder Advisory Group. In many ways, the Stakeholder Advisory Group is the linchpin that draws together and ensures that all of those areas are very much interlinked and informing each other. The purpose of the Stakeholder Advisory Group is to operate as an advisory group to involve both the non-government sector and content experts in the development, implementation and monitoring of policy and programs relating to the child and family service reforms. Additionally, the group may be requested by the Minister and/or Director General to provide advice about a number of specific issues that may emerge during the course of implementing the inquiry's recommendations and the reform process. The members of this group include representatives from the Department of Communities, Child Safety and Disability Services, other key government departments, peak bodies including Peak Care, QCOS, QATSIP, Foster Care Queensland and the Create Foundation, representatives from academia and non-government organisations involved in child protection and the family support services sector. Members are appointed for a 12-month term which may be reviewed and/or renewed. The terms of reference for the Stakeholder Advisory Group broadly look at the following areas. Firstly, to identify, define and more clearly articulate the outcomes being sought for children, young people and families. It will then look at developing and designing the right range and mix of services and responses that are able to achieve these outcomes. It also has responsibilities for looking at a number of the enabling systems. That includes the legislation and policy that's needed to govern and guide the administration of those services and responses. It also will look at the infrastructure, means and processes necessary for planning, managing and delivering those responses, as well as the workforce that's needed across government and non-government sectors to deliver on those outcomes that we are seeking. Lastly, we'll look at all the various processes and means necessary to maintain the system and also ensure its continuous improvement. There will also be a capacity for the Stakeholder Advisory Group to co-opt members from at different times. These might be people who have specialist knowledge that can inform the work of the advisory group. That includes sometimes running workshops with a much broader range of people who can also come together to inform the work of the advisory group. Additionally, there will be a number of very specific projects that are developed under the umbrella of the advisory group, and as well as needing to be undertaken to implement the reforms. This will involve the establishment of project reference groups, co-design groups, and running workshops around specific matters. It's very likely that representatives of our member agencies will be attending some of these groups at different times. Additionally, and in keeping again with a strong emphasis placed on by the inquiry, is the formation of regional child and family partnership groups, local alliances and local project groups that are meant to bring about the place-based planning that's necessary to apply the reforms to a local context. As the processes for planning and implementing the program of reforms proceeds, PCare will be making use of a range of communication strategies to provide as much opportunity as possible for our members and supporters to firstly remain up to date and well informed about the direction and progress of the reforms, and secondly, and very importantly, to allow you to inform and engage in the process of reform. Some of those strategies that we will be using include some that are tried and true. It will include posting information on the PCare website, our Facebook page, making use of videos, our e-news and emails to relay information to you. Also, periodically, we'll be running teleconferences and webinars about specific matters. Whilst they are the tried and true methods, we will be looking at refining our use of each of those strategies to become better vehicles for the exchange of information. Secondly, we are embarking on pursuing some new strategies. In particular, this will include the use of Yammer to establish consultation and discussion networks with representatives from our member agencies and supporters. For those who haven't yet heard of Yammer, it's a new private social network that allows information to be quickly and very efficiently shared, including the uploading of files and videos, and allows group conversations and collaborations to be very easily facilitated. As various projects evolve, PCare will be regularly calling for nominations of people from our member agencies to join various discussions or collaboration networks to explore issues, exchange opinions, discuss and/or plan a range of initiatives. In addition to that, we will not turn our backs on the plain old-fashioned methods of face-to-face meetings and workshops. Sometimes these are absolutely the best way of communicating. As we proceed down this track, member agencies are advised to stay tuned for the first invitation that you will soon receive to nominate persons interested in forming a network via Yammer to discuss the 3 new child protection bills: the Public Guardian Bill, Family and Child Commission Bill, and Child Protection Reform Amendment Bill. In case you aren't aware, submissions about the bills are due by the 14th of April. In forming a discussion group, we are hoping to both receive your advice about concerns or things you're pleased about in relation to the bills, so that that may inform PCARE's submission, and in exchange of that information, we may also inform a submission that is lodged by your own organisation if you choose to. We hope you've enjoyed this video. There will be many more to come, and many more discussion groups hopefully that will follow, as well as workshops, as well as other communication strategies that we hope to engage you in, so that we together can embark on this journey towards a much improved child protection system.